I spoke to Julie Fisher. She's a health policy professor at the Milken Institute of Public Health, and I asked her if countries should handle the Ebola epidemic as they would a natural disaster.
What we've seen from the past, from SARS, from H5N1 avian influenza, and now from Ebola, is that these incidents cause not only a health concern, but they also can cause security issues and can cause real fears in the public for legitimate reasons, but also can be managed effectively if we address them like we do other disasters and we learn from the past. So part of that is understanding who has the technical ability and who at the ground needs the training, the supplies, the resources, and the human power to go out to take care of patients, to train people in hospitals, to provide enough support so that the healthcare workers who are dealing directly with patients have the equipment and the experience that they need to protect themselves and to prevent transmission to others. We can learn from this. This is a disease that we understand relatively well, and we can apply those lessons going forward as we look for emerging infectious diseases that we have not yet even anticipated.
Well, let's take a look at the training, as you mentioned. There have been a lot of complaints around the world about the lack of training for healthcare workers. So who is in charge of training? Who would provide that? Who's in charge?
So I think that has been a real lesson learned in the United States. The CDC did issue guidance several months ago on how healthcare workers could use personal protective equipment to protect themselves and to prevent Ebola transmission. But that guidance was primarily paper guidance, forms, posters, diagrams, and clearly hands-on training is the key. There's no substitute for experience, for drilling, and for practice. We do know that in West Africa, in the 3 most affected countries, Médecins Sans Frontières, the Doctors Without Borders organization that has treated so many of the patients and done such a good job protecting their own staff, do intensive hands-on training, practicing taking their gear off safely and using gear and equipment safely to protect patients while they're providing the best standard of treatment that they can.
There's been a lot of talk about lack of money. The WHO says it needs $1 billion to fight Ebola, and so far they've seen less than half of that amount. The UN Secretary General Kofi Annan said that he is disappointed by the lack of international response. Is money the only answer, or what else can be done to eradicate Ebola?
Money is part of the answer, because we need gear and we need equipment and we need some of the very basic non-medical supplies like vehicles and fuel, and the logistical support to get trained people with the right equipment and materials at the right place at the right time. And for that we do need money. But we also should recognize that the limiting factor there is going to be people. We have to have trained healthcare workers on the ground who are willing to stay in West Africa for the weeks to months that it takes to be trained and then to contribute to the effort before they go back home. So money is important, resources are critical, but human resources are what's needed at the end.
Julie, thank you so much.
Thank you so much.